You are welcome to the International Herbal Medicine Center. This episode is called, Ulcers in the Stomach. An ulcer is an erosion of tissue that leaves an open wound. A peptic ulcer is a sore in the lining of the stomach or duodenum, the first part of the small intestine. If peptic ulcers are found in the stomach, they are called gastric ulcers. If they are found in the duodenum, they are called duodenal ulcers. You can have more than one ulcer. A gastric ulcer, also known as a stomach ulcer, is a sore or lesion that forms in the lining of the stomach. These ulcers can be painful and may lead to various digestive symptoms. Here are some key points to understand about gastric ulcers. Watch the video to the end as we explain the symptoms, diagnosis, treatment, diet recommendation, herb recommendation and juice therapy for stomach ulcers. If you've been enjoying our content and want to stay up to date with our latest videos, we'd love to have you as part of our YouTube family. By hitting that subscribe button below, you'll be among the first to know when we release fresh, exciting content. Your support means the world to us, and it fuels our creativity and motivation to create more of the content you love. Causes. Gastric ulcers can develop due to various factors, but the most common cause is infection with the bacterium Helicobacter pylori, H. pylori. Other contributing factors can include the use of non-steroidal anti-inflammatory drugs, NSAIDs, excessive alcohol consumption, smoking, and stress. Symptoms. The symptoms of gastric ulcers can vary, but common signs include burning or gnawing abdominal pain, often felt between meals and during the night. Other symptoms may include bloating, belching, nausea, vomiting, and unintended weight loss. In some cases, gastric ulcers can lead to complications like bleeding or perforation. A duodenal ulcer, also known as a peptic ulcer, is a type of sore or lesion that forms in the lining of the duodenum, which is the first part of the small intestine. Duodenal ulcers are a common type of peptic ulcer and share many similarities with gastric, stomach, ulcers. Here are some key points to understand about duodenal ulcers. Causes. Duodenal ulcers are primarily caused by the bacterium Helicobacter pylori, H. pylori. This bacterium can weaken the protective mucus layer of the duodenal lining, making it more susceptible to the corrosive effects of stomach acid. Other contributing factors may include the use of non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin or ibuprofen, smoking, excessive alcohol consumption, and stress. Symptoms. The most common symptom of a duodenal ulcer is a burning or gnawing pain in the upper abdomen, often occurring between meals and during the night. This pain can be relieved temporarily by eating or taking antacid medications. Other symptoms may include bloating, burping, nausea, vomiting, and unintended weight loss. Diagnosis. Diagnosis of a duodenal ulcer involves a combination of a physical examination, medical history review, and various diagnostic tests. Common tests may include endoscopy, a procedure using a thin tube with a camera to view the duodenal lining, blood tests, stool tests, or imaging studies. Complications. Untreated duodenal ulcers can lead to serious complications, including bleeding, resulting in anemia, perforation, a hole in the duodenal wall, and obstruction, a blockage in the digestive tract. These complications require immediate medical intervention. Treatment. Treatment for gastric ulcers depends on the underlying cause. In cases of H. pylori infection, a course of antibiotics is often prescribed to eradicate the bacteria. Medications like proton pump inhibitors, PPIs, or H2 receptor blockers may also be prescribed to reduce stomach acid production and promote healing of the ulcer. Lifestyle changes, such as avoiding alcohol and NSAIDs, may be recommended. In severe cases, surgery may be necessary. Treatment for duodenal ulcers focuses on eliminating the underlying cause and promoting ulcer healing. Antibiotics are typically prescribed if H. pylori infection is confirmed. Medications such as proton pump inhibitors, PPIs, or H2 receptor blockers may be prescribed to reduce stomach acid production and allow the ulcer to heal. Lifestyle changes, including avoiding smoking, moderating alcohol consumption, and discontinuing NSAID use, may be recommended. In some cases, surgery may be necessary, although it is less common today due to the effectiveness of medical treatments. Diet recommendation: high fiber, complex carbohydrate diet. A high fiber diet has been associated with a reduced rate of ulcers. Researchers have found out over the years that diets that contained a lot of refined foods, such as white flour and white rice, were associated with a high rate of duodenal ulcers. Increase omega-3 fatty acids. Some studies suggest that omega-3 fatty acids, which are found in fatty fish like salmon, mackerel, sardines, trout, and herring, and supplemental fish oil such as cod liver oil or krill oil, may help reduce the risk of ulcer. Eating small meals frequently throughout the day. This helps relieve stress on the digestive system. Need to avoid foods that increase stomach acid production or aggravate the condition, such as fried foods, black tea and coffee, strong spices, black pepper, red or hot pepper, chili powder, animal fat, carbonated drinks and peppermint. Eliminate food allergies. Clinical and experimental evidence points to food allergies as a primary cause of ulcers. A diet that eliminates food allergies has been used with great success in preventing and treating recurrent ulcers. Herb recommendations: aloe vera, in a dosage of 4 ounces daily, can help stop ulcer bleeding and speed the healing process. Do not use aloe bitters. Licorice, in the form of deglycyrrhizinated licorice, DCL, promotes healing of gastric and duodenal ulcers. DGL is available in chewable tablets from most pharmacy. Juice therapy: parsley juice is rich in beta-carotene, bioflavonoids, vitamin C, and zinc. Intake should be limited to half a cup or a cup a day. Overdose of can be toxic. Alfalfa and wheatgrass juice are good sources of vitamin K and blood-purifying chlorophyll. These prevent bleeding, aid healing, and neutralize stomach acid. Barley grass juice is another good choice. Pineapple juice contains brodylane, an enzyme that improves digestion and relieves symptoms of ulcer. If you experience persistent abdominal pain or other symptoms suggestive of a duodenal ulcer, seek medical advice promptly for diagnosis and appropriate treatment. Early diagnosis and treatment can help prevent complications and promote healing. If you've been enjoying our content and want to stay up to date with our latest videos, we'd love to have you as part of our YouTube family. By hitting that subscribe button below, you'll be among the first to know when we release fresh, exciting content. Your support means the world to us, and it fuels our creativity and motivation to create more of the content you love.